Diabetes is a serious health condition that can have far-reaching consequences on both your physical and mental well-being, right? One of the areas in which diabetes can be particularly damaging is the liver. The liver, right? With damage often happening very quickly if left unchecked. For this reason, it is essential that you are aware of the warning signs so you can take action as early as possible. So today's video provides that vital information about the warning signs of diabetes-related liver damage and ways to prevent it, as well as most recent and advanced non-invasive tests to catch the disease at early stage. So tune in now to empower yourself with knowledge. Today, we will talk about signs you need to pay attention to before it is too late, but also managing your risk factors. And most importantly, I will tell you the best tests that your doctor can run to determine early liver disease. The liver is a large organ, right? Comparable to the size of a football. It is located on the right side of your abdomen, just below your rib cage, and it protrudes slightly if you're skinny. The digestion of food and the elimination of harmful substances from the body are both processes that depend on the liver. Now, there is a genetic component to liver disease, right? We know that. In addition, liver problems can be brought on by a variety of factors that are harmful to the liver, such as viruses, excessive consumption of alcohol, and obesity. And cirrhosis, which is a form of scarring, can develop as a consequence of conditions that are harmful to your liver over time. Now, liver failure, as a result of that, is a condition that poses a significant risk to anyone's life. However, receiving treatment as soon as possible might give the liver more time to recover. Liver disease isn't always preventable, but you can take steps to reduce your risk of developing it. If you are concerned about your own personal risk, consider factors like heavy alcohol use, obesity, type 2 diabetes, insulin resistance, having history of tattoos or body piercings, injecting drugs, using shared needles, blood transfusion before 1992, exposure to other people's blood and body fluids, unprotected sex activities with multiple partners, exposure to certain chemicals or toxins around the home or workplace, and a family history of liver disease as well. All of these can raise the odds of developing liver damage, so it's important to understand them and take action accordingly. Now, staying away from heavy drinking and drug abuse are two significant preventative measures everyone should take, regardless of your current state of health. You may be the healthiest person, but if you are practicing these things without being careful, then you may end up with liver failure because of the viruses that you may get. Reaching out for professional help if you feel at risk is highly advised so that you can actually make informed decisions about how best to protect yourself. Liver disease is an unfortunate and sometimes sneaky condition, right? That many people don't realize that they may have it until it's progressed to fairly serious stage. Much of the time, liver disease people may experience few to no visible signs or symptoms, making it hard to detect in the early stages. However, if signs and symptoms do surface, they can range from mild to severe and include jaundice, that is a skin, your eyes, your skin can get yellowish, right? Abdominal pain, swelling, swollen legs or ankles, itchiness on the skin, dark urine color, pale stool color, chronic fatigue, nausea, vomiting, loss of appetite, and increased tendency for bruising easily. It's important for anyone experiencing any of these indicators to book an appointment with their doctor as soon as possible in order to receive a proper diagnosis and management. The number of people, for example, who have alcoholic fatty liver disease ranges from 10 to 30% in some countries. The range of the disease includes benign steatosis, which is fat accumulation, which has a low chance of getting worse. But when you have steatohepatitis, which is fat accumulation and inflammation, which affects 15% of people, then this quickly leads to fibrosis and cirrhosis, which is the later stage. So for aggressive management, it is very important to find that small fraction of people, and that could be you. So ultrasound is a good start, right, in finding the fatty liver, but it can't tell the difference between simple fat in your liver or fat that is inflamed. So steatosis versus steatohepatitis. Ultrasound cannot tell you that. Now, serum transaminases, which are your AST, ALT, you see on your blood work, they are the liver enzymes that are good at telling if there's inflammation, but again, not specific enough for, or very good at telling if someone has steatohepatitis. Because fatty liver can cause AST, ALT elevation, but that doesn't mean that you're at a super high risk to begin with. Only a liver biopsy, which is the gold standard test, can find this small fraction of people, or 15% of those people, who are likely to get worse and develop into cirrhosis. But it's not really practical to do a liver biopsy on everyone, right? Especially when they have non-alcoholic fatty liver disease, because they're so common. It should only be done on people with diabetes, obesity, metabolic syndrome, and fairly high liver enzymes. But even when there is a risk or high risk of fibrosis, like in diabetic patients, the population is so big to make it worth doing an invasive procedure to rule out fibrosis on everyone. So what are we going to do? Well, small number of non-alcoholic fatty liver patients who need a liver biopsy actually need an easy, quick, accurate, and non-invasive screening test, right? That's the best way to screen the whole masses, the population. Now, if you haven't heard of that, I'll tell you this now, and you should probably talk to your doctor about it. Fibroscan, also called transient elastography, okay? Transient elastography measures how stiff the liver is by estimating how fast a shear wave moves through the tissue. So Fibroscan is quick, painless, and it's a test to measure the stiffness of the liver. During the procedure, basically you just get an ultrasound probe that transmits that shear wave through the liver tissue and records how long it takes for the wave to return. And that information is then processed in a computer that uses an algorithm to determine how stiff your liver is and predict its risk of damage due to fibrosis and cirrhosis. Although not widely available in everywhere, but nowadays it is. It used to be not very widely available, but now it's becoming standard of care, okay? This type of test may be recommended by your doctor, or you can just bring it up, especially if your liver function tests are abnormal and you need more information about your condition. Then that is something that you need to consider as a diabetic. If you think you may be at risk for fibrosis or cirrhosis, make sure to ask your doctor whether Fibroscan might actually benefit you. Now, having said that, again, this is not a sponsored video. I am just telling you as a physician what I do, what I would like to do, and what I want you to talk to your doctor about. So again, a big thank you, everyone who stopped to watch. And don't forget to subscribe, share, like, and thank. Please don't forget to watch one of our many other videos. Whenever you conduct a search on Google or YouTube, just simply add the sugar MD word to the end of the search term, and I promise you will find something to watch or read about. I'll see you later. Hey Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.